And we'd have to have federal funding for those people, I think. Or maybe we wouldn't even be able to handle it if we had 20,000. Then I was thinking, well, where are we gonna get our customers? We'll probably get customers that are dissatisfied with their current, that are maybe paying a premium, but their insurance didn't cover this particular procedure, or every time they put in a claim, they get a big hassle, and they say, well, we want something else. So, is there a strategy where we're gonna get people that can pay, people that are, getting maybe bare minimum or whatever?
Yeah,
And uninsured,
right.
recognizing that we can't have an overabundance, we could have an overabundance of people that can pay the premium, but we can't have an overabundance of people that are uninsured.
Right, so the target populations, to answer Jim's question, would be, that we've talked about, would be, it makes total sense to build on the co-ops we have in Minnesota. Minnesota leads the country in food co-ops and credit union co-ops. We've got 500 artists living in co-ops, in northeast Minneapolis, and you got another 350 living in co-ops in lower town of St. Paul. I mean, you don't have to go door to door,
Can I just add one thing? I think you raised a very good point. And if I have to make a suggestion, one thing obviously is when Bradley said that we should start forming teams who will work on these particular areas. And in order to get people who will pay the premium and join us, the best target market is small businesses. All small businesses, being a small business, I know what they are going through. Number one, they like to insure their employees, but the problem with them is the premiums are very high. Okay, in small business. So if we start targeting small businesses that have 5 employees, 10 employees, 20 employees, to go and present them this idea that this is what we are trying to do. And let's say tomorrow, in case you do run into a problem where your employee becomes sick, your premiums are not going to be raised by 33% or 10% or 20%. They will like those ideas, and they will be a very good candidate to join our organization. As a matter of fact, I also told Joe that I get my car fixed by somebody over here, Filarities. There's a shop over here, and I was just talking to him, and I said, who is your insurance company? And I explained to him about this co-op. He said, whenever you guys are ready, we will join you, because all small businesses, they will start up maybe $200 a premium or $300 a premium, and suddenly their premiums are now $500, $600, $700, and they are being ripped off every day. That's the best target population that we can go after. And get 20, 40, you can easily get a lot of people.
Okay, so let me try to summarize, having made these points here. So the areas that Jim and Rakesh are talking about, so we need people to work on funding, and then we also need people to work on, as I was mentioning, membership development, or outreach, whatever you want to call it, but trying to talk with, food co-ops, with small business associations. Metro Independent Business Association is a very, progressive small business association in the Twin Cities. They're single payer advocates. So small business associations. We also have listed artists, because there's so many uninsured artists, and they live in cooperatives. Farmers, a lot of farmers don't have health insurance. There's a Minnesota Farmers Union, which we've had working on single payer with for a long time, and we know some of the people at the Minnesota Farmers Union. One of the applicants, by the way, that did get funding is a farmers union in another state. I can't remember which state. So if you have the whole group of people that you can say is committed and dedicated to being a concerted pool, that's actually the best thing in terms of funders. They want to know that you have a pool, then they know that it's gonna be a committed pool, and they're not gonna get like a lapse rate from your, 10% aren't gonna leave the pool each year, you know what I mean? It's not-
Make like a pledge, like I pledge, if this happens, when this happens, like I would be interested in becoming a member on my own terms, et cetera. And have that shared with friends, et cetera, on Facebook, something like that.
Okay, well, that's a really good point. This is getting good now, all right, this is what we want here, some brainstorming. So then the question is really, in addition to organizations, what about individuals? It's kind is what-
Social media.
Yeah, social
Yeah.
media.
It's
Okay,
silly not to.
yeah, social media, right, individuals, so, for that, we have been, and again, we're just, I guess we don't have, what we have is the listserv. Basically, when Jim, Joan, and Jeannie, and myself, we call ourselves the J unit, Joel, Jeannie, Jim, Joan, and
We had
there's
to change our names.
my daughter's JD, it just goes on and on.
Joe reminded me George Foreman.
So, like over the spring and summer and stuff, when we were doing tabling and outreach, and Jeannie, I didn't forget about you, I want you to introduce yourself in a second, but
Oh,
basically what we would do is, that listserv, we would just say, if you're at all interested in this, we'd like you to be on the listserv. There was no like commitment to being a member, it was just.
it was really quick.
Well, we have Facebook, right?
Yeah, we have
Yeah.
a Facebook page.
We
If
have
a
all-
video,
yeah.
we can put that on there.
Okay, yeah, so it was already said, the 3-minute video, a draft letter of intent, the PowerPoint presentation, and so are we saying that we need a letter, something for individuals? Like a membership?
Once you amass this big database of folks, once you are up and operational, you'll be able to send them information. Say, hey, this is how you get to the health information exchange, this is how you sign up, this is, for me, I'm self-employed, I'm just my one person, so this is something that I would be interested in. But if I signed up on Facebook and said, yes, I would be interested in this whenever you get it set up, then at least you'll contact me hopefully. So that might be, a way to.
It's just another tool.
Yeah.
Mhm.
So, I mean, I think the membership development letter is on, yeah, it's on
It's on the website,
the
but
website.
Yeah, but Joe, I think the one suggestion I would like to make right now, since we have some young new members who have come over here, to kind of make a group and assign a task. So instead of you taking over every task.
Oh, absolutely,
So
yeah.
assign the task. So, I would love you guys to join, let's say, become a team, and we can say, well, this team is going to go and start identifying, let's say, this database of people who will join us. And then we can help you, like letter of intent is one, we can help you with that. We can help you with a video, maybe you guys can produce that on your own, or we can help you with that. So this way what happens is that now we have a team that is working on this particular item, which is very crucial for the success of this organization.
Yeah.
So that's, I think, if we can accomplish that today, I will be very, then we
Yeah.
have something solid.
Yeah, absolutely,
You should look at, 30% for profit insurance, or profit insurance versus like 3% for like Medicare or Canadian-based system.
Mhm.
And then follow-up question, what sort of funding are we allocating towards attracting appropriate talent to providing a good service and a competitive service?
What I can tell you is that all of that has actually worked out. I mean, that's something that, I've spent a lot of time on that, and, there's this actuarial firm that has been doing pro bono work. So another thing to keep in mind is that as we keep trying to refine the business plan and marketing strategy, the more sort of sweat equity or pro bono work that we put into this, that's actually there's actually, you can value that. And I have been actually, saying, if like, let's say this federal funding, that's public funding, but they also want to know how much private funding you can raise. And I've been actually like, budgeting that, for the amount of time and effort that people have put into it,
Yeah,
you know,
if you
like-
do, if you go and study, Switzerland has many insurance companies, but under the law in Switzerland, you can only use 5% of the money for the administrative costs. The 95% of the money has to be spent on the actual care.
Just seems reasonable, right?
Yeah, and that seems reasonable. That's what the goal is. But we don't want to really tie ourselves initially too tight either. We want to tie up. Government says 85%. We are saying 90%.
Okay.
But I think Joe has fairly all the details in the business plan. So that's the direction we are heading.
Yeah, and again, the quick answer is that this really is a single payer model. That this cooperative really is, because I do have to mention, there has been a bit of schism, or whatever, if you will, in the like single payer community, which is a lot of people, a lot of groups out there and stuff. There are some people who say, well, we're dyed-in-the-wool single payer advocates, and and your co-op would be more of a distraction. And then I keep trying to say, well, no, we're actually a really good first step, because we are using single payer principles of one pool, one payer, directly contracting with providers, and we even are gonna try to go to global budgeting, which is a really key single payer principle. Global budgeting, not fee for service, and there's a lot of administrative savings there. So yeah, all of that stuff is really built into this the model here.
Does the business plan also address then the contracting of provider services and clinics and hospitals and things?
It does, and I definitely want to send out summaries to. We'll have to get like a tally, so you'll see that there would be 4 different departments, for the co-op. One of those departments would be provider network. That's really key. Another department would be like enrollment and accounts administration. So enrollment and provider network are really key. That's like the key thing to doing all this. Enrollment and provider network.
That means if I had, let's say, some procedure done, or maybe MRI done, or CAT scan done, and suddenly I am in Chicago and I need some treatment, and they suddenly want to see if I have a record of any CAT scan or MRI, well, here is data. You can check it out. Here are the reports. So there is no duplication of the service, so the expenses don't go up for the insurance company as well as for our members. So that's what my goal is, that we will have that all centralized data fully managed, completely HIPAA compliant. We all will abide by all the rules and regulations that are out there, and at the same time give that power to the patient, and patient can manage and control from whichever location they are. So this way we will be able to make our organization a lot more effective. We will be able to keep the cost down, and we will be able to provide much higher quality of healthcare than anybody else. So that's the whole idea.
Great, and there's no reason why we can't do that, equally to the way actually better and more efficiently than the insurance companies do it. 'Cause-
No?
Yeah.
I would love to.
Yeah.
Stay after for 3
Yeah.
days.
Yeah.
But to put it really, in simpler terms than that, like the way I understand it is that, we have to just have a database, like SQL, for enrollees, and we would need administrative people in the enrollment department to say, okay, well, here's an individual, they have to be enrolled, so they're, it goes into a
I would think we
database.
would really want him as an ally. He
Yeah.
would be
Yeah.
strong. I think we just wanna be
It could very well be.
respectful and courteous and professional with this. And,
Because we're above average.
I mean, yeah, we have
Co-op
an
that
image,
phrase,
we have an
Julie.
image we wanna create, and I think,
It's wholesome.
yes.
Not a bunch of cheaters and
You're
stealers.
on it, you're on it.
Plus
Excellent.
reputation management,
Excellent
PR.
point. So the